Brought to you by GTA, your island, your network.
San Nicolas says public spending on local health care has ballooned to $70 million since 2010, which doesn't include money to meet the chronic shortfall at the hospital, which he says averages about $27 million a year.
If we were able to reprioritize our public spending so we can make sure that we're paying down the shortfall rather than having the money go into other areas, then we can address the GMH problem without having to raise taxes or borrow money.
Reprioritizing means taking money from one public program and using it for another. What would he slash? The local medically indigent program and the local matching funds for the federal Medicaid program.
If we were to be able to reprogram some of that funding in order to meet GMH's critical needs, then I think it would be a win-win for those very same patrons of those entitlement programs, because not only would there still be a Medicaid program existing, but there also would be a GMH that's fully funded.
The San Nicolas plan is in contrast to bills by the governor, which call for a $125 million bond to renovate a wing of the hospital and turn it into a money-making outpatient services facility, and raising the business privilege tax from 4% to 4.75% to pay for the bond and to cover the chronic GMH operational shortfall. It's legislation San Nicolas opposes.
Raising the GRT is going to put tremendous burden on the very people that it's trying to help. It's going to raise medical costs, it's going to raise food costs, it's going to result in probably a less healthy environment.
For Guam's News Network, I'm Nestor Lecanto.
Brought to you by GTA, your island, your network.